My father passed away. And my mother wanted to stay home as long as possible. She was a very dignified person. She really didn't want to go to a nursing home because I think she saw her parents and they were there and they just sort of deteriorated.
I don't drive anymore. I gave up driving.
I'm on a fixed income. I'm single, and I'm supporting myself.
My dad was in the hospital, and he was really, really sick. And it's the first time that you're taking care of your parent.
Well, we want to keep Mom with us, you know, and she lives with us, and it's getting less and less comfortable to leave her alone.
My parents I moved them in with me, and I was at a place where I just really did not know what to do to bring in care for them.
Right now, I'm healthy, I can get around, I can do my cooking, etc. But the day will come, I'm sure, because as a law of averages, senior citizens become frail and they can't do things that they've always done in their life, and you need that extra help.
I had come down a flight of stairs and I stopped because I suddenly felt like I was going to fall down. Pains in my shoulder and my arm. It was a heart attack. Can't say it was a good experience, but it was an experience in my healthcare, which I learned a great deal about, and I learned how good SCAN was at that particular time too.
Our mission and goal at SCAN is to keep and or provide services to allow seniors to stay in your home absolutely as long as possible.
Cooking, shopping, buying groceries, maybe doing laundry, or maybe making a bed is too much strain. Little things that one does ordinarily, a time comes one can't do those things, and therefore it's wonderful to have someone come in and do that. It saves you from going into an institution.
We help explain things, answer questions, help them with the transition.
She's the one that actually really helped my dad transition from his hospitalization to home.
Before I was out of the hospital, someone from SCAN came in to see me about, did I have to go up and down stairs? Could I handle, could I take care of myself? They were very concerned about all these things. I've never had anyone do that in a plan before.
Member services is just like the hub, and we have a bunch of spokes, and we can just connect them everywhere that they need, to the pharmacy department, to transportation, to the outer area nurse.
SCAN brought food for my parents before we even asked. We didn't even request the food.
You're only old once. I've never been through this before. I don't know what I'm going to need and what I don't need, so the more options I have, the better.
SCAN has helped them regain their independence, which I feel is very important.
I love the fact that there's a program out there where people do actually care about you, and they will take the time to follow up and find out how you're doing and if you need anything extra.
I feel that if a person has the ability to stay in their own home, within their own environment, where they're comfortable and familiar with the surroundings, they do better.
Most seniors would like to remain at home. They don't like to go into institutions, but they have no way out, so they go. But with SCAN, you can stay home and enjoy your home environment, and life keeps going as it has. It's a blessing. It really is.